Hi, Dr. Martin. I heard you had a question for me. What did you want to talk about?
I'm sorry, but are you the pharmacist? I just had a question about citalopram.
Yeah, I'm the pharmacist on duty. Citalopram, okay. It's an antidepressant, and it comes in 10, 20, and 40 milligram strengths. It's excreted in the urine, and it has a half-life of about 35 hours. For side effects, there are sexual side effects, heart side effects, and stomach side effects.
Okay, but I just wanted to know if it interacts with phenelzine.
Oh, yeah, I think that should be fine.
Okay, thanks for that. I have an appointment to run to.
All right, thanks. Call me anytime. Hi, Dr. Martin. I heard you had a question for me. What did you want to talk about?
Here the pharmacist should have introduced herself and verified the physician had time to talk. She also should have verified the purpose of this interaction.
I'm sorry, are you the pharmacist? I just had a question about citalopram.
I am the pharmacist on duty today, and citalopram, it's an antidepressant. It comes in 10, 20, and 40 milligram strengths, and it's excreted in the urine. It has a half-life of about 35 hours. For side effects, it can cause stomach problems, heart problems, and sexual problems.
The pharmacist should have asked if the physician had any specific questions before rushing to give them information about citalopram. They also used patient-level language when describing the side effects, which is inappropriate when speaking with a physician.
Okay, but I just wanted to know if it interacts with phenelzine.
Oh, yeah, I think that'll be okay.
The pharmacist clearly did not know the answer to that question. Phenelzine and citalopram, when taken together, significantly increase the risk of serotonin syndrome. The pharmacist should have admitted that she did not know the answer and offered to get back to the physician.
Thanks for that. I've got an appointment to run to.
All right, great talking to you. Call me anytime.
The pharmacist was disorganized and did not introduce herself. She did not make sure the physician had time to talk or see what specific questions the physician had. She used patient-level language and also guessed when asked a question she did not know.
Hi, Dr. Martin. I'm Lori. I'm the pharmacist on duty here today. I understand that you had some questions about the medication citalopram. Do you have a minute to talk about that?
Yeah, I do. Just a couple of minutes, though.
All right. Well, do you have any specific questions?
Nothing specific. I just am unfamiliar with the medication.
Okay. Well, citalopram is an SSRI medication. Its indication is for depression, and it's typically dosed as a 20 milligram tablet, but it is available as 10, 20, and 40 milligrams. Any patient started on this medication should be monitored for improvement in symptoms in 4 to 8 weeks.
Okay, what about side effects?
There are some side effects to this. It can include GI effects, sedation, or sexual dysfunction. But if you have a patient that suffers from any of those things, you can try either decreasing the dose or changing them to a different agent. Do you have any other questions?
What about, does it interact with phenelzine?
Oh, that I'm not sure of. Can I get back to you later on this afternoon with that answer?
Oh, sure.
Fantastic. Thank you.
Thank you.
Hi, Dr. Martin. I'm Lori. I'm the pharmacist on duty here today. I understand that you have a question about a medication called citalopram. Do you have a minute to talk about that?
This is a good opener. The pharmacist introduced herself and also verified the physician. She briefly explained the reason for the call and made sure the physician had time to talk.
Yeah, I do. Only a couple of minutes, though.
All right. Well, do you have any specific questions for me today?
This question assures that the pharmacist answers the physician's real question.
Nothing specific. I'm just unfamiliar with citalopram and want to know a little bit more.
Okay, well, citalopram is an SSRI, and it's indicated typically for depression. Its normal dose is a 120 milligram tablet once a day, but it does come as a 10 milligram, 20 milligram, and 40 milligram tablet. If you start a patient on this medication, you would monitor their improvement in symptoms in about 4 to 8 weeks.
Okay, and what about side effects?
The side effects are generally mild, but you might look for GI side effects or sedation and sometimes sexual side effects. If you have a patient who experiences these, you might decrease their dose or switch them to a different medication.
The pharmacist here identified the drug, its indication, and its class. She also touched on the dosing and what strength it's available as. She also talked about side effects and what to do in case a patient experiences these.
What other questions do you have for me today?
Well, does citalopram interact with phenelzine?
I don't know the answer to that right offhand. Would it be all right if I got back with you this afternoon on that?
Sure.
All right, great. Thank you.
The pharmacist here did a great job. She introduced herself and made sure the physician had time to talk. She also asked questions to find out what the physician's real question was. One asked a question she did not know. She offered to get back to the physician at a later time.